Hello everyone, my name is Heshha Chavda and today I will be presenting my applied practice experience portfolio for the Master of Public Health program at Eastern Washington University. This presentation will include an introduction, discuss my major work products, the activities that I completed during the APE, the connection of the work products to the CEPH competencies, a conclusion, a reference section, and appendices. The purpose of my applied practice experience is to demonstrate the five CPH competencies for the culminating course to achieve a master's in public health. I will discuss the growth and reflection and showcase three major work products that have been produced during the APE to support all the selected competencies. As a public health intern and a dental professional, this experience allowed me to connect my background with public health principles and address real world challenges within the clinical environment. The location of my APE was the Glenside Dental. It is owned by Dr. Elaine Shan and a general family dental practice in Richmond, Virginia. With Dr. Michael Shakru serving as the associate dentist. Both the dentists are highly skilled and experienced professionals who have created a supportive, patient-centered environment. During my APE, they have provided valuable feedback, encouragement, and mentorship, which has enhanced my learning experience and professional growth. This site was especially meaningful for me as Glenside Dental is also my current workplace with my role as a dental assistant there. This has allowed me to integrate my academic public health knowledge with my ongoing clinical experience and deepen my understanding of how oral health promotion and preventive care aligns with broader public health goals. My site supervisor was Dr. Eileen Shan, and my APE professor was Dr. Shavonda Devereaux. I worked on three major work products. Number one was to create awareness on dental waste management in the workplace. Number two, enhancing patient understanding of post-treatment pain management in dental care. And number three, develop educational materials on the impact of oral health on systemic health. Let me start by discussing work product one, which is to create awareness on dental waste management in the workplace. This work product was focusing on reviewing current office procedures for dental waste management and compare these practices with the OSHA and EPA guidelines to develop a concise guidance report for the staff. Waste is a direct consequence of human activity, and the quantity of waste generated is often an indicator of a community's economic strength and development. Dental practices generate a large amount of waste, such as cotton, plastic, latex, glass, and other materials, many of which may be contaminated with body fluids. Most dentists use sharps, lancets, needles, and syringes during routine patient care. Improper handling and disposal can lead to needle sticks or spread of disease, not only for those using healthcare products, but for anyone finding them. Needle sticks can result in diseases such as HIV and hepatitis. To keep sharps and other potentially infectious waste out of the trash and therefore prevent the spread of disease, proper disposal is needed. It has been estimated that up to half of clinical waste contents are incorrectly disposed of. So, by increasing staff knowledge on appropriate waste segregation, this will not only cut costs but also have a less detrimental environmental impact. Implementation of sustainable waste practices within dentistry is a small but significant step to tackle the profession's environmental burden. Poor waste segregation can lead to increased atmospheric methane gas, which is one of the largest contributors to climate change. The benefits of improving staff knowledge on sustainable waste practices cannot be underestimated due to growing global concern about climate change. Next will be work product 2, enhancing patient understanding of post-treatment pain management in dental care. This work product will evaluate patient understanding of pain management instructions and knowledge after the dental procedures in collaboration with the dentist. It will redesign post-treatment instruction sheets to make them more patient-friendly. Clinical dentistry is often accompanied by varying levels of pain and discomfort during the post-operative period. The use of over-the-counter medications is insufficient, which prompts the patients to seek further care. Understanding patient experiences and outcomes is vital for improving pain management strategies and enhancing recovery. Studies suggest that patients could recall less than half of the oral healthcare advice provided by their dentist, which underscores a notable communication shortfall. Patients with limited oral health literacy tend to have a reduced capacity to assimilate health information and are less familiar with dental concepts. This leads to hindered communication with dental personnel. Patients with lower oral health literacy may be less able to communicate with dentists effectively as they tend to ask fewer questions. There is a need for dental professionals to take the patient centered approach as a premise and acquire verbal and non-verbal communication skills to overcome these communication barriers. Instructions and communication in simple, succinct, and technicality free language should be used. A holistic approach is needed for pain management that places an emphasis on all encompassing care that takes the patient's physical, emotional, and psychological health into account. Next is work product 3, which is to develop educational materials on the impact of oral health on systemic health. This work product will research how systemic diseases affect oral health and develop brochures that explain these links. The World Health Organization has defined health as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. As the definition of health emphasizes overall well being, it is important to look at health disciplines similarly. In dentistry, poor oral health impacts not only physical health but also mental and social health. Oral diseases have been associated with diabetes, cardiovascular disease, and rheumatoid arthritis. Mechanisms that mediate this connection between oral and systemic health in a susceptible host include predisposing and precipitating factors such as genetic factors, environmental factors like stress, habits such as smoking, and high fat diets or consumption of highly processed foods, medications, microbial dysbiosis, and bacteria, and an altered host immune response. Oral health is tied to one's quality of life through oral function, overall health, self perception, social acceptance, and social interactions. Diseases such as dental caries or cavities can cause pain, impaired chewing, reduced appetite, sleep disturbances, and reduced daily performance. Dental diseases can also lead to edentulism, impacting speech and facial shape, which affects the psychological well being of individuals and confidence during social interactions, self perception, stress levels, feelings of depression, isolation, and frustration. Research suggests that prevention is just as important as treatment. Educating patients during their appointments improves their oral health but also empowers them to make informed decisions about their dental care. Integration of patient education into every visit can help foster long-term engagement and encourage proactive dental habits, which should ideally reduce the risk of severe systemic health issues. When patients understand the impact of dental conditions on their overall health, they become more motivated to maintain their oral health between visits. This knowledge reduces the risk of severe dental issues and promotes overall well being. Next section will discuss the activities that have been completed during the applied practice experience. The people that were involved in my APE was Dr. Eileen Shan, who is my supervisor, Dr. Michael Shakru, who is an associated dentist with Glenside Dental, and the dental assistants. OSHA and EPA dental waste guidelines were used, the clinic's existing waste management policy, online educational resources, existing post-operative instruction sheets, patient and staff surveys, observations, and peer-reviewed articles on oral systemic health connections of cardiovascular diseases, diabetes mellitus, and rheumatoid arthritis were used on also online resources on effective patient communication. Guidance and approval from the dentist on the accuracy of the health content and suitability for patients. Review meetings with both dentists to align materials with clinical accuracy and patient readability were the inputs for this APE and work products. A research was conducted for the background on OSHA and EPA dental waste guidelines, reviewed existing office waste procedures, collected staff feedback using structured surveys. Other activities included analyzing gaps between current practice and regulatory standards and developed a dental waste guidance sheet, designed a patient survey to assess clarity and comprehension of current instructions, observed post-treatment counseling sessions and identified common patient misunderstandings, drafted educational brochures linking oral health to systemic conditions, and implementation of brochures in patient education sessions and observed engagement. The outputs of this APE was dental waste guidance sheet on proper waste segregation and disposal, revised post-treatment pain management instruction sheet with improved readability and illustrations, patient educational brochures linking oral health to systemic health conditions. The anticipated outcomes for this APE was improved staff awareness and adherence to staff dental waste practices, reduce risk of improper waste disposal, and enhance environmental compliance. Visual graphs explaining survey findings, reduced instances of confusion on post-operative instructions, increased patient comprehension and adherence to post-treatment instructions, encourage proactive dental visits and better patient compliance with oral hygiene recommendations, enhanced patient awareness of the importance of oral health in systemic disease prevention, and improved overall health outcomes. Now, the connection to CPH competencies with these work products, I demonstrated 5 CPH competencies. Number one, apply epidemiological methods to the breadth of settings and situations in public health practice. Competency number two, select qualitative and quantitative data collection methods appropriate for a given public health contents. Competency number nine, design a population-based policy, program, project, or intervention. Competency number 18, select communication strategies for different audiences and sectors. Competency number 21, integrate perspectives from other sectors and or professions to promote and advance population health. Now, competency number 1 was demonstrated by work product 1 and work product 2. The supporting documentation was the waste management workflow analysis and surveys of the staff and the patients and development of a guidance report based on OSHA and EPA evidence in a PDF format. There are also graphs of data from patient survey. Competency number 2 was demonstrated by work product 2. The supporting documentation was survey tools with open-ended questions and a summary of findings in a visual graph format. Competency number 9 was demonstrated by work product 1 and work product 3. The supporting evidence was concise waste management guidance sheet for staff as a PDF and finalized brochures explaining systemic health links as a PDF. Competency number 18 has been demonstrated by work product 2 and work product 3. And the supporting evidence is the redesigned post-treatment instruction sheets with simple language and visuals in a PDF format. Also, easy to understand brochures in a PDF format. Competency number 21 has been supported by all three work products 1, 2, and 3. And the supporting documentation is the review from the dentist. My applied practice experience at Glenside Dental has greatly strengthened my ability to combine clinical knowledge with public health practice. Throughout this experience, I refined my skills in communication, program planning, and evaluation, while also gaining a deeper appreciation for the vital connection between oral health and overall community well being. This experience enhanced my confidence in applying public health principles within a real world clinical environment and allowed me to recognize my strengths in teamwork, patient education, and leadership. It also highlighted areas for continued professional growth, particularly in data analysis, which is a skill essential for designing evidence based public health initiatives. This applied practice experience has reaffirmed my passion for advancing oral health equity and my commitment to becoming a dentist who actively promotes community based initiatives to help reduce disparities in access to dental care. It has also solidified my vision of contributing to a healthcare system that values prevention, education, and inclusivity as integral components of public health. These are the reference section. Next are the appendix section, which will begin by reviewing work product 1. This is the dental waste management guidance sheet that have been created. It provides standardized instructions for the proper disposal of dental waste to ensure staff safety and regulatory compliance with OSHA and EPA. It demonstrates 4 major different types of dental waste: sharps, biohazard, chemical, and amalgam. The guidance sheet has disposal instructions for each particular type of waste with pictures and demonstrations, which will be easy for the staff to follow. It includes another guidance about the PPE, how they can actually take care of the waste in the office by ensuring safety. And there is a reference section. This was existing OSHA waste management guideline at Glenside Dental. Appendix C has the survey form for understanding the dental assistant waste management practices. These are the results of the survey. It demonstrates confidence in proper disposal of dental waste, where 50% of the assistants felt confident or very confident, and 1/3 of them expressed only somewhat confidence levels. This indicated a uncertainty and inconsistency in staff knowledge. For being the familiar part with OSHA and EPA guidelines, none of the assistants reported being very familiar with federal regulations. The equal split between familiar and somewhat familiar highlights a knowledge gap in regulatory requirements. These are the challenges that have been experienced with dental waste disposal. For 6 dental assistants, 5 out of 6 reported experiencing challenges with disposing of dental waste. Only 1 assistant reported having no difficulty. The majority of dental assistants are encountering difficulties. This is the feedback form for work product 1 by Dr. Elaine Shan. Next, we'll be demonstrating work product number 2. This is the revised post-treatment instruction or pain management sheet for the patients at Glenside Dental. It demonstrates bleeding control, pain and infection control, swelling control, avoid smoking, why it is important for them to avoid smoking. It discusses oral hygiene practices, what to do if there is a feeling of nausea, what to eat, what not to eat, what if there are sharp bony edges in their mouth after the extraction of these, and when exactly they can call us, or what to do if there is an increase in pain. It has visuals for the patients to follow, simple language so that they can understand easily and remember um, their instruction sheets. This is the existing tooth extraction post-operative home care instructions for patients at Glenside Dental. This is the patient feedback survey form that was created to understand pain management after dental treatment. It includes open-ended questions. The results of the survey that the patients took demonstrated that 25 of the patients reported that instructions were very clear, indicating the need to simplify and clarify post-operative guidance. 50% of the patients did not fully understand how to safely take pain medications, showing a critical communication gap. About the confidence in managing pain, a majority of patients who took the survey reported only moderate or low confidence in managing pain at home, supporting the need to improve patient-friendly instructions. Next will be work product 3. This is an educational guide connecting oral health and systemic health conditions. Firstly, it has been discussed about oral health and cardiovascular diseases. It explains what exactly is cardiovascular disease, how gum disease impacts their heart, and warning signs that the patients can watch for, and how they can protect their heart and the mouth both. I have included some visuals for the patients to review. Next is oral health and diabetes mellitus. I've discussed the links between diabetes and oral cavities, how diabetes affects their mouth, how oral health affects their blood sugar, signs for the patients to look for, care tips for the patients with diabetes. It includes visuals as well for the patients to understand and get some clarity. Next is oral health and rheumatoid arthritis, how both of them are linked, how rheumatoid arthritis affects your mouth, the shared pathways of inflammation, symptoms to watch for, and helpful daily care tips. This is the reference section for work product 3. Thank you for reviewing my applied practice experience and taking your time to review it. Thank you.